growing COVID-19 crisis, various initiatives are being taken worldwide, where numerous organizations of various scale and are contributing as much as they can towards the efforts. In a recent press release, the WHO, in collaboration with the Health Ministry of Malaysia, announced that the country has been selected to be a participant in the, quote, solidarity trial. Over 70 countries have already signed up to it also. And we have an update coming in from Ruby Tinawin. Ruby?
Yes, hi Alma. 9 hospitals in Malaysia will soon start drug trials for COVID-19 as part of the global research effort launched by the World Health Organization. Health Director General Dr. Hisham said the trial will adhere to safety standards set by the National Pharmaceutical Regulatory Agency. The trials would test the effectiveness of 4 treatment protocols using different combination of the drugs remdesivir, lopinavir, ritonavir, interferon beta, chloroquine, and hydroxychloroquine. Dr. Ying Rulo, head of mission and WHO representative to Malaysia, Brunei, and Singapore, said one of the drugs may be the world's best hope to treat COVID-19's infected people. This is our chance, according to her, as a global community to turn the tide against the pandemic. She also added Malaysia will be a valued partner in this trial to evaluate potential treatments that are more effective to save lives in the global battle to fight this virus. Meanwhile, mass testing for COVID-19 in Malaysia will continue, but the health ministry said the priority will be given first to the high-risk group people. This means those people who attended public gathering like the Tabligh event, the Tafi school students, as well as those who returned from overseas. Now, if before Malaysia allow those who return from overseas to self-quarantine, now since last Friday, Malaysian authorities, they have quarantined 25,000 people returning from overseas since Friday in its centers and hotels. So they are no longer allowed to return home. So Noor Hisham said the ministry's current testing capacity was 11,500 a day, but they're hoping to increase it further. Also, inmates in 12 prisons here in the country are making personal protective equipment or PPE for healthcare workers managing COVID-19 patients. Deputy Home Minister Dato Sri Dr. Ismail Muhammad Said said all sewing workshops in these prisons were giving priority to making PPEs because of the urgent need for them now. He said this is the initiative of the prisons department to help lighten the burden on the government in handling the COVID-19 issue, as well as to reduce the risk faced by the frontliners, especially the healthcare staff. He commended the inmates for their voluntary effort, who work very hard every day to ensure adequate supplies of PPEs. He said the effort by these prisons had the support of their state government, which contributed the materials and distributed the PPEs to the hospitals. Ismail said the skills the inmates learn from the prisons will help them start a new life, and many had said they intended to make sewing a source of income when they are released later. Now, on another note, police said online gambling and sale of illegal cigarettes have become rampant since Malaysia went into partial lockdown under the movement control order. At a press conference at Bukit Aman yesterday, the Inspector General of Police, Abdul Hamid Bador, said online gambling had become widespread, with scammers taking advantage of the MCO to lure those at home into taking bets. He also added scammers are targeting Malaysians and are also eyeing those getting financial aids from the government to deposit the money into their accounts. Hamid, on the other note, he said there had been a spike in cigarette smuggling as well, especially along the nation's borders. On his statement, he also urged drug addicts showing symptoms of COVID-19 to go for health checks as life is more precious. He said the narcotics department was only taking action against the big drug cases, and drug addicts should not be afraid to come forward for screening. Now, nearly 180,000 refugees and asylum seekers are registered with the UN High Commissioner for Refugees in Malaysia. Most of them are from Myanmar. Now, refugee community group estimate that more than 80,000 have no documentation as they await registration with the UNHCR. Malaysia, on the other hand, is not a party to the UN Refugee Convention and lacks a legal framework for refugees who are considered illegal immigrants, and a policy known as Circular 10/2001 requires healthcare providers to report such people to the police. Now, refugees also lack the right to work in Malaysia, leaving most to find an income in the informal sector with only limited employment protections at most. As such, when the COVID-19 epidemic happened, it has exposed not only the difficulties faced by refugees and asylum seekers in getting medical treatment, but also the risk that it creates for public health as a whole. Although the law is not always applied, past records showed refugees and asylum seekers, particularly those without papers, have been arrested after going for treatment or giving birth. Now, healthcare costs can also be prohibitive. According to Hospital Kuala Lumpur website, non-citizen must pay a foreigner rate, often 100 times higher than local rates.
Okay, Ruby, so what is
Alma?
the government going to do with the refugees and the asylum seekers? What measures do they have to be implemented for them so that they will not be infected with COVID, or they can be protected as well? Do you know
Okay,
if
the
they have
thing
any?
is, there's a large group of these refugees who were the Myanmar who attended a Tabligh event, and out of fear that they will be arrested, they do not want to come out and seek any medical help. Now, the defense minister said last week that the government would not arrest anyone based on their immigration status. Especially if they sought medical services in relation to COVID-19. And the Ministry of Health also announced COVID-19 treatment would be free for foreigners showing symptoms. Now, the UNHCR also worked with different organizations. They set up a hotline in 8 different languages to actually assist, give the necessary interpretation, necessary information to provide all the details that all these refugees and asylum seekers need, where to go, who to talk to in case they are in need of help. However, the ironic part is roughly, out of 90 calls they receive each day, more than 70% are requests for financial assistance. Alma?
Okay. Thank you very much for that, and we'll be waiting for more updates from you. We'd love to hear more because we're all interested in what's happening in Malaysia. Thank you. Stay safe and keep healthy. Stay healthy.
Okay, thank you. From EBC Malaysia Bureau, this is Ruby Tinawin. We live in interesting times.